Hello, thank you so much for participating in the Wellness Wave brought to you by ACP Southern California Region 3 chapter. My name is Asta Shah and I'm a medical student at UCSD representing this chapter of ACP. So for the viewers, could you please tell us a little bit about yourself and what you do?
Yeah, my name is Chris Gonzalez. I'm a second year internal medicine resident over at LAC USC. A little bit about what I get to do every day, quite a variety of things. Some weeks I'm in the outpatient clinic. Some weeks I'm in the hospital working with interns or third year residents, either on the med surg floors or in the ICU. We cover a variety or rotate through a variety of specialty services as well. So I get a chance to work with a variety of patients and really see most of the patients in the hospital.
Awesome. And how did you end up choosing this career path in medicine?
Ultimately, thinking about the future when I was a third year and a fourth year even, I initially wanted to go into surgery, but didn't find that I had quite the passion for it that was really necessary to go into the field. For me, thinking on my clinical experiences, I really enjoyed each of my rotations. There wasn't a particular field that I was drawn to. If anything, I liked a variety of aspects of medicine. And so, yeah, internal medicine left a lot of doors open, and ultimately it would give me time to really get a sense for, where I wanted to be moving forward. So.
Absolutely. Do you have any advice for medical students that are currently figuring out their path in medicine?
Don't be afraid to ask your attendings, even ask the residents that you're working with, what their journey was, how they ended up making their decisions. I think it's a great, oftentimes we get caught up in the workflow, and we forget that, we all have shared experiences. So there's definitely some good insight and wisdom that you can pick up from the team that you're working with or the provider you're with in clinic. So yeah, definitely ask around.
That's great advice. Thank you. And then now pivoting a little bit towards wellness, I wanted to ask, what is your favorite wellness phrase or your favorite wellness quote?
Well, I think often, especially on busy ward services, I try and remind myself to not complain about things that I'm not willing to change, and to kind of give some context to that. I think it's fun to commiserate with your colleagues about things that are really hard and challenging, but it gets to a point at times that we're often just complaining about our experiencing and not our experience and not really building each other up, or we're just kind of focused on the negative, and that can be hard. And so it's important to keep a positive attitude, and really focus on a lot of the beautiful aspects of the work that we get to do as doctors. So.
Great. Dr. Gonzalez, you've been an incredible leader through running the UCSD Free Clinic, as well as through initiatives in LMSA. What advice do you have for other medical students and residents who would also like to be student leaders?
Ooh, great question. I think it's really, look for the need. Just look for a way to be of service. And you'll find that there are a lot of opportunities to really take initiative and to help out and to make a change, whether it's with a student organization or in a clinic that you're associated with. If you make yourself available, keep your head up and look around. It's easy during medical school and during residency to focus on on your own experience and kind of what you're doing in the moment. The next test, the next the next note you have to write, but there's need all around us, and there's need for leaders and people to really make an impact in our environment. So yeah, just keep your head up and you'll find the opportunities.
It's great advice. Thank you so much. And thank you so much for sharing your knowledge with us overall. I'm sure myself, other medical students, residents, and all of our viewers will most definitely benefit from the advice that you shared today. Thank you.
Thank you for the opportunity, and to the viewers, best of luck moving forward.